You do online coaching? I do online coaching, but specifically for NCLEX, and it's one-on-one coaching. All right. So here we go. Question number 26. Mr. J develops hepatic encephalopathy. Which clinical manifestation is most common with this condition? Is it increased urine output, altered mental status, decreased tendon reflex, or is it hypotension? What are we thinking? The answer is B, altered level of consciousness. Changes in behavior and level of consciousness are the first signs of hepatic encephalopathy. Hepatic encephalopathy is caused by liver failure and develops when the liver is unable to convert protein metabolic product ammonia to urea. The result is accumulation of ammonia and other toxics in the blood that damage the cells. Physiological adaptation. Third largest section on the NCLEX. Okay, accumulation of ammonia. Did I say anemia? I'm in ammonia. Damn, see, my bad. Y'all know what I'm talking about. But third largest section on the NCLEX exam, physiological adaptation, 11 to 17%. All right, question number 27. Patrick suddenly develops diarrhea. The nurse best action would be to what? I'll see if your physician is in the hospital. Maybe you're reacting to the drug. I will withhold the next dose. I'll lower the dose as ordered. So the drug causes only 2 to 4 stools per day. Frequently, bowel movements are needed to reduce sodium levels. What are we thinking? And the answer is C. Somebody just said it. They was just like, it's not sodium, so it's C. Hey, way to read the question. Way to read the question, but also good job on reading the answers. RTFQ, RTFA, RTFR. All right. So lactulose is given to a patient with hepatic encephalopathy to reduce absorption of ammonia in the intestines by binding with ammonia and promoting more frequent bowel movements. If the patient experiences diarrhea, it indicates overusage, and the nurse must reduce the amount of medication given to the patient. The stool will be mushy or soft. Lactulose is also very sweet and may cause cramping and bloating. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. All right. Question number 28. Which of the following groups of symptoms indicate a ruptured abdominal aortic aneurysm? All right. Is it lower back pain, increased blood pressure, decreased RBCs, and increased WBCs? Severe lower back pain, decreased blood pressure, decreased RBCs, increased WBCs? Severe lower back pain, decreased blood pressure, decreased RBCs, and decreased WBCs? That's in there twice. Or is it D, intermittent low back pain, decreased blood pressure, decreased RBCs with an increased WBC? What are we thinking? And the answer is B, severe low back pain, decreased blood pressure, decreased RBCs with an increase of WBCs. So severe lower back pain indicates an aneurysm rupture secondary to pressure being applied within the abdominal cavity. When rupture occurs, the pain is constant because it can be alleviated until the aneurysm is repaired. Blood pressure decreases due to the loss of blood into the abdominal cavity, y'all. Where else do you think the blood's going? Okay. After the aneurysm rupture, the vasculature is interrupted and blood volume is lost. So blood pressure wouldn't increase. For the same reason, the RBCs have decreased, not increased. The WBCs increase as cells migrate to the site of injury. That is physiological adaptation. Third largest section on the NCLEX at 11 to 17%. All right, 11 to 17%. Understand how these disease processes work, ladies and gentlemen. That is how you're able to use your critical thinking to make a clinical judgment. Here we go. Question number 29. After undergoing a cardiac catheterization, Tracy has a large puddle of blood under her buttocks. Which of the following steps should the nurse take first? Keyword is first. All right. What is the very first thing that you're going to do? Call for help? Are you going to obtain vital signs? Are you going to ask the client to flip over? Or are you going to apply gloves and assess the groin site? What are we thinking? And the answer is D, apply gloves and assess the groin site. Okay, it says observing standard precautions is the first priority when dealing with any blood fluids. Assessment of the groin site is the second priority, right? This establishes where the blood is coming from and determines how much blood has been lost. The goal in this situation is to stop the bleeding. All right, that is a reduction of risk potential, which is 9 to 15% on the NCLEX. Fourth largest section on the NCLEX exam. Question number 30. Which of the following treatments is a suitable surgical intervention for a client with unstable angina? Is it a cardiac catheterization, an echocardiogram, nitroglycerin, or a percutaneous transluminal coronary angioplasty? What are we thinking? And the answer is D. It's a percutaneous transluminal coronary angioplasty. All right. The PTCA can alleviate the blockage and restore blood flow and oxygenation.